So, why should we have health care for every person, young, old, rich, poor? You know, when I was raised in Evansville, my parents were conservative Republicans, still are conservative Republicans. I come from a family of lawyers. But we were raised with a sense that, you know, I mean, my brothers know I was fighting with each other over every little thing we could fight over. And, you know, fairness was always an important thing. I mean, my father, I mean, he believed in the rule of law, but that's too abstract a term. But he said there should be a level playing field, you should be fair, you should do things so everybody's got a chance. And I think just like we have universal education, we should have universal health insurance, because I don't see how people are going to get out of poverty when they're sick. You know, I think we should, and I don't think we should be dragging down our economy because people are sick either. But I think universal health insurance is part, healthcare is really just part of the fabric of our communities. It's part of, you know, our basic infrastructure, like schools, like bridges, like clean air, like clean water. I mean, I think this is what we need to do. I think it's the right thing to do. And I think we've got to do it. I think it's crucial that we do it. This woman says, what do I want for Christmas? World peace is asking a lot. I'd settle for universal health care. And I put this in here because, I mean, I think there are some really tough issues. You know, there is global warming, and there is world peace. Those are really tough. But universal health insurance is something that we could actually do. We could do it in the next 5 years. And I think we should do it, and I think it's inevitable that we will do it. I think it's going to be a hard road and a long road, but I think we're going to get there. I'll quote from Margaret Meach, it's one of my favorites. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. So I'm a member of a couple of groups. One of them is called Hoosiers for a Common Sense Health Plan. And this is an Indiana group that's based here in Bloomington. I live here in Bloomington. But it's a statewide group. And then there's a national group that I'm a member of, Physicians for a National Health Program, or PNHP. I'm the state coordinator for that group. There are about 14,000 doctors in the country who are members of that group. I'll go back to HCHP. We're talking about forming a Hoosiers for Common Sense Health Plan student group. Katie, you want to raise your hand back there? Talk to Katie back there in the back, or my wife Karen, who's in the way back at the table. And she's got some cards. If you want to get a card that's got our website on it, you can go to this website, hchp.info. There's a ton of information there. There's even an online petition, and Karen's got a paper copy of the petition. But what we're trying to do is to do something actually at the state level right now. There is a bill before Congress. It's called H.R. 676. And it was written by a congressman from Michigan. It's got about 77 sponsors right now, but the bill in Congress is not moving right now. And so we think maybe we should do something at the state level. And we've been actually very encouraged because actually a bill passed both houses in the California legislature at the end of August to put universal health insurance coverage in the state of California, but it was vetoed by the governor. So we've written a bill that's going to be submitted into the Indiana legislature this coming January, and we're going to try to do something here in Indiana. Now, Indiana's going to be a tough sell for this, but if we can do it in Indiana, we can do it everywhere. But I think that's probably what it may take, is some state doing something on a statewide basis, and then it'll spread to the country, because that's actually what happened in Canada, was that they did universal insurance in Saskatchewan first, and then later it spread to the whole country. So I'd love to answer questions, and I'd love for you all to think about this being an issue that you might want to be involved in. There's plenty of work to be done, and I appreciate your coming out tonight.